Hello everybody, welcome to my YouTube channel Nurse Simplified, where we just simplify your concepts and make it easier for you. So today we will discuss about insulin drip calculation. It is one of the requested um, questions by our nurses, even our students. Let's proceed. Before we go on to the calculation, what do you mean by an insulin drip? So it is a drip which involves administering your insulin intravenously or IV, which allows for faster, more accurate adjustment of your blood sugar levels, which are quite high at the time of admission, or patients with DKA, that is diabetic ketoacidosis. You will see this happening compared to subcutaneous injections. So we move on to the calculation. We have drip problem 1, and the order given by the physician is 2 units per hour. The pharmacy will supply to you 100 units per 100 ml bag. Now, be very careful that you may get the supply from pharmacy with different concentration. It may be 250 units in 250 ml bag. It may be 250 units in 100 ml bag, or it may be 100 units in 250. So be very careful or vigilant to read what is on the bag. Now is your answer is to calculate. How do you calculate the infusion rate into ml per hour? So here we will use dimension analysis. What do you mean by dimensional analysis? I'll just use a pen. A dimensional analysis means using something or where you have lot of unit conversions happening together simultaneously. We prefer to use dimension analysis. Now here we have 2 units. We will divide it by 1 hour. So 2 units per hour into 100 units per 100 ml bag. So in this you will get 200 by 100 units. If you cancel both of them, like if you cancel the hundreds together and you will cancel the units together, so you will get 2 ml per hour. Okay. So your infusion rate is 2 ml per hour. Let's move on to the next question. Again, the order by the physician is 15 units per hour. He will tell you, sister, you start at 15 units. They will never tell you ml per hour. They will always tell you units per hour because they don't know what supply is coming from the pharmacy. So this time I kept it same 100 units per 100 ml bag, but be very careful what they will give you. So the question is now calculate the infusion rate, that is ml per hour, and I want you to tell me the infusion time. So first you will do step by step. First the infusion rate. Here again, as I told you, I prefer to use a dimension analysis when there are unit conversions happening. So 15 units per hour and divided by 100 ml bag by 100 units. So in this case, the units and units will get cancelled like we did last time, and 100 and 100 you can cancel here. So here it will be 15 ml per hour. Am I correct? Okay. Now we are left with the infusion time. How do I do the infusion time? So 15 units. This is a calculation of how I got 15 ml per hour. Okay, this is my ml per hour. For now, for the time, I need 100 ml bag by to be 100 ml divided by 1 into 1 hour divided by 15 ml. So your 15 ml gets cancelled, ml gets cancelled, and you are left with 100 by 15, that is 6.66. 6.666 hours. So 6 hours. Now my task is to convert this 0.666 into minutes, approximate minutes. I cannot do 6666, Rasa. So 0.666 hours into 60 minutes by 1 hour. So here also again hour and hour will get cancelled. So 0.666 into 60 will give it 39.96 minutes, which you will round it up always. Decimals will always be rounded up in drug calculations, as we have learned before, to 40 minutes. So my answer is 6 hours and 40 minutes this infusion will run. Okay, is it clear? So this is all about the insulin drip calculation. In the next videos, I'll be giving you sums and answers. Let's see. Thank you. so much for your patient listening, and keep watching Nurse Simplified for simple concepts, and stay tuned for future videos. Bye bye.